Hey y'all, it's your girl. Hey y'all, it's your girl Janine. Welcome to my YouTube page. Please like and subscribe. I hope you can see me good. I'm out here at the lake and it's a bit sunny. Um, I just wanted to get on here and clarify a few things. But also I really wanted to say too first that healthcare it's rough, man, y'all. Just navigating the healthcare system, coordinating your care, like you're doing like all this work, and a lot of times the doctor's offices don't even know where the hospitals, and they're putting you as the middleman, and you got to go back and forth. It's really good if you can get a case manager with your insurance company because that's what case managers do. They help you coordinate your care. And so you don't have to be stuck going back and forth because you're already suffering with whatever you have going on, your sickness, your illness, you're in pain. Less is possible. We need, right? We need to utilize the people that's been placed in our lives to be a help to us. I know sometimes we think that we can just do it all by ourselves, you know, but that's why we have people to help us, y'all. So if you didn't know, I'm telling you, if you have a chronic illness, call your insurance company to see if you qualify for a case manager. And if you do, have that case manager help coordinate your care. Okay? I have one, and sometimes I don't even take advantage of it. It's one of those things where you're so used of doing it yourself. You're so used to being in this fight. But like, why do it if you don't have to? You know? So I'm just kind of feeling like that today because I've been going back and forth with the neurosurgeon's office about two different situations in preparation for this surgery. About two medicines that I take for lupus. They want me to stop a week or two before the surgery. Well, the surgery is next Thursday. And so I still am trying to figure out if it's necessary for me to stop. Because I don't want to stop it because my symptoms come back. And so I've been going back and forth between the hospital and the doctor's office. And also with something else. Let me think, I forgot that fast. To know if I need to get a clearance from my pulmonologist doctor. So here's the thing. I was also diagnosed with restrictive lung disease, and this came after the lupus diagnosis. And the neurosurgeon's office told me I don't need to see a pulmonologist to get clearance. When the anesthesiologist called me to do her question, she told me she would think that I would need to, but they can't make the decision. So she sent me back to the neurosurgeon's office. Neurosurgeon sent me back to the pulmonologist. So I was going back and forth, back and forth. And I made an appointment with a pulmonologist, then I canceled. And so I had to, make a long story short, I had to call today because now the anesthesiologist made the decision per the neurosurgeon's office that I need to see them for clearance. So thank God when I was on the phone with their office today, someone canceled an appointment and I got an appointment for tomorrow. Nobody but God in his favor, man. I'm trying to tell you. So this is a pain in the butt. That's why I'm saying, if you have somebody that can help you with this, use it. Don't be stubborn like me, y'all. The other thing I wanted to talk about is clarity. In previous videos, I mentioned having a partnership with your doctor, and I also mentioned them working for you. And so for me, they're one and the same, right? And I just want to clarify what I mean when I say that. So when you have a partnership with your doctor, you're coming to your doctor with your concerns, and your doctor is saying, okay, let me see, what we can do for you. And once the doctor decides, he's asking you, is this okay? So I'll give you an example. I'm coming to the doctor. I got a lump on my arm, and the doctor's saying, okay, well, let's get this checked out to make sure it's nothing serious. I'm going to order an x-ray. Is this okay with you? You say yes. He said, okay, where would you like to go? You can go here, you can go here, go here. And you said, okay, I go here. He said, would you like for me to fax it over to them? And you said yes. So if you need a prior auth, the doctor's office coordinate that. They call the insurance company, they get the prior authorization, and they call you with that prior authorization number, and you take it to get your x-ray done. And so this is what I mean about that partnership. You're included. It's between you and your provider. Y'all have a plan. Okay, y'all working it out together to make sure that you have a successful health journey. Okay, and what I mean by the doctors working for you is just that. You go to the doctor and you need something, it's their job to help you get better. You go to the doctor, because if you're sick, to help you get better, right? Because they're prescribing the medicine. They're sending the medicine to the pharmacy. They're making sure that, you're not, it doesn't interact with any of your other medications. And the pharmacy also plays a role in that too at the end. But this is you going to the doctor saying XYZ is wrong, and the doctor going the extra mile to make sure that you get back to your normal health, to make sure that he gets to the root of the problem, right? So that's the doctor working for you, okay? But he also includes you in that, and that's why I'm saying partnership as well. So for me, it's one and the same thing. They work for you because their insurance company, because your insurance company pays them. But also you have a partnership because the doctor is supposed to include you in your care. You make the final decision. You understand? Not the doctor. You say, okay, I don't want to take this medicine, or I'm okay with taking this medicine. So I hope you understand that healthcare is so complicated, y'all. But I just want y'all to know, like, we gotta be vocal and to help ourselves. Because I know we talk about health equity, and that's what we're fighting for, to eliminate health equity, right? The lack of justice and fairness in healthcare, to, especially for people of color, right? And so we want to make sure that we also do what's best for us when we go to the doctor. So don't forget, y'all, write down your questions before you go, the name of your prescriptions, the names of your the surgeries you had, the name of the specialists and all the doctors that you see. Am I missing something? Write down your diagnoses if I didn't already say that, right? And make sure you get there early so you can make sure you have your appointment on time. If the doctor's not running behind, and you can have that allowed time that's scheduled for your care. And so that's how we can make sure, and also use our voice, right? And so that's how we make sure our end. Okay, so I hope y'all understand. I'm just throwing that out there, something that was on my heart. But like and subscribe, and I love y'all. Peace out. Peace and blessings.